Okay, so on the line here we have Miss Rose who wants to say greetings. Miss Rose, good afternoon.
Good afternoon, Mr. MUTABARUKA. How are you?
I am totally okay if you are okay.
I can't complain, sir. Believe me, I would be lying if I do.
All right. All right. Your parents is Jamaican or you was born in Jamaica?
Both my parents are Jamaican. I was born and raised in Jamaica. Went to high school in Jamaica as well.
You're serious? How long ago that? I don't want to give away your age.
Well, as fabulous as I look for my age, I'm not ashamed of it. It was 20 years ago.
20 years ago you leave Jamaica?
Yes, sir.
Okay, and you have been living in Texas all this time?
No, I actually relocated from New Jersey to Texas about 7 months ago.
Oh, just 7 months?
Yes.
All right, so what kind of nurse are you now? What kind of nurse? Because we hear about nurses, you know, and them have different position, situation. What kind of nurse are you? I
am a registered nurse. I have a bachelor's degree in nursing, and I work in emergency. I've been an emergency room nurse since I graduated.
Okay, and you've been working at this hospital, the Presbyterian Hospital, for how long?
For the past 7 months.
Oh, 7 months?
Yes.
Not very long, eh?
Not at all.
And to come to this big explosion, you know, that you are now wanted to do interviews all over the world.
Unfortunately, yes.
Yeah, well, we give thanks that you really accept our invitation to do this interview, because what we want, we just don't want to only hear as a Jamaican that you are a nurse who treated Ebola, but we want to know what is the things them that you did in that hospital so as not to you yourself get this virus, because we hear that a lot of people now is looking about these people is getting the virus. What we want to find out is, when did you know that you had to take care of this Mr. Duncan?
It was just the night that I went to work. I didn't have any knowledge of him or anything about him until I went to work that Sunday night that I was assigned to care for him.
So you didn't have no training about how to take care of Ebola patients or nothing?
Not at all. We've never experienced anything like that. Ebola is something that I have been reading about on my own, so it's not something that we're exposed to on a day-to-day basis.
So when you hear that you have to take care of Ebola patients, what's the first thing come to your mind?
At first, like everyone else, it's like, this is a joke. It has to be a joke. I know that it's not true. Yeah. And then as the report went on, I realized that it's a possibility. Then as the night went on, then I realized that it is true. So
what did you do now? I mean, after hearing that you have to take your Ebola patient, what is the precaution that you were thrust into? What did they do to make you now prepare yourself to take care of this patient?
Well, first, of course, you know, as I had mentioned before, that I did prepare I cried first, and then I just got myself together, and our protective wear is something that we're trained on. That's not foreign to us. Mm-hmm. The spacesuit is new because we've never done anything like that. Yeah. But regular protective wear, that's something that you do use on a day-to-day basis. Mm. It depends on the kind of patients that you're caring for. Yeah. So that's never been anything new to me. So, putting it on and taking it off, I guess I could say that I am a professional at that, because it's something that you have to do to protect yourself.
All right. So when you put on, all right, the patient, Mr. Duncan, is in his room or wherever he is. You are not the only nurse that was treating him, but was taking care of him. Were you the only nurse? No? I was.
You
was the only nurse?
Yes, I was quarantined with him.
You're serious?
For the whole night, yes. One of the gentlemen who was on the panel with me, he came and assisted me a couple times throughout the night, but I was his primary nurse.
All right, tell me, carry through the journey now that you're in this room with this Ebola patient. What you're supposed to do?
Well, anything that he needed, that was, my responsibility as his nurse. Anything that he needed, whether it was medication, assisting him in any way that was necessary, checking his vital signs, just about anything. That was my responsibility.
And then how you treat now, when you come out of that room, what you do when you come out of that room, given that you have on this thing that was exposed to the man inside there, what they don't put on anything on him? Is there something that they put on him? He's just there like ordinary?
Yes.
With his pajama and whatsoever?
Right. I would just take my dirty gloves off, clean my hands with some hand sanitizer, put on fresh gloves. Then I would take my gown off and my shoe covers, change those gloves again, clean my hands, leave the room, and then I would wash my hands with soap and water and remove my mask so that as the night went on, I was, doing that, and I would change how I would do it. So I made sure that I never left the room and contaminate the other areas where I had to be.
With the same clothes? You don't leave the room with the same clothes on?
Well, I had the same clothes on because I had my scrubs on the whole night, but just not the gloves or gown or anything that I wore in the room apart from my scrubs.
All right, so is the room is it have compartments where you are here, you take off the clothes here, and how it work? What the room is like?
Just a basic single room, and then because I was in an entire area of the hospital that we were sequestered in, so I had the whole outside to myself, and he was just confined in his room. Okay.
So you could change in a little part and then put on your ordinary clothes and leave.
Right.
You don't have to come back to where he is. There's another exit that you leave out of.
No, not necessarily. It was just a regular area with just his room that I didn't have, that I would go in and out of with just one door, so we didn't have another room like that. But once you walk out his room, you're in that entire area of emergency, yes.
All right. So what was it like now, after you've done your work, going home to your family or seeing your friends? How were you treated by these friends and family? How did it work?
I left work that morning. My sister was waiting for me because she had to get to work. I made sure I did put on a new pair of shoe covers so that I wouldn't, bring anything into the vehicle. I wiped down the vehicle with some bleach wipes. I had already taken the precaution and quarantined myself. So I didn't pick up my niece from school. I didn't allow her to come back into my room or use my bathroom like she usually would, or play in my bed or do the things that she loves to do.
Okay.
I had kept her at bay. My sister, left work early so she could get her. So for those couple of days, I was quarantining myself and just kind of not sharing anything with her or with my family, because in the back of my mind, I knew what was happening, even though it wasn't out yet, but I kind of knew, so I was just taking precautions.
All right.
Yeah.
So when you heard that he died, what came over when you heard that he died? Were you was there when him dead? I mean, or it worked?
No, I worked that Tuesday night into Wednesday morning, and he died while I was on my way home from work.
Oh, yeah?
He passed away, yeah.
So when you hear that now, you started to cry again?
Absolutely.
Wow.
Yes, absolutely. I was hurt because I was really hoping that we could have saved him.
So what did not happen? Why you think he died? I mean, because we have heard of other people getting over it. Why is it so unique to this person that he died and nobody else died?
Well, so many people are dying from the disease.
No, I mean in America at the same time. Because whenever he have his family having it, he was amongst his family. They quarantined his family in the house. They quarantined other people. They was looking for other people who they say might have come in contact with him. You have any other people who came in contact with him dying.
Right, and that's such a blessing. We're very happy that no one else who was
died.
Around him,
yes,
caught that terrible disease. I can attest to that. I know that my hospital and my colleagues did everything that they could and more to try to save his life, and unfortunately that wasn't the case.
All right, we're hearing of experimental Zima, the drug Zima that is used to help other people. Was there any sign of this drug being used on this man, Mr. Duncan?
I don't have access to his chart because once he left emergency, I didn't. I was no longer a part of his care.
Okay.
So I don't know what medication was given to him while he was there. Under my care, that's different. But again, I can't attest to that because I don't know.
Yeah, and what happened to all right, you was in quarantine for how long? After he died, how long?
I wasn't in quarantine until the 12th of October. They had me in, and then they pulled me back out and said I was no risk. And so I went about my business, and I was still using precaution amongst my family and friends, limiting my exposure to people, but I was still going to work. And I went into quarantine after I cared for the first nurse who came down with the illness.
Okay, so what happened to that nurse now? Where's that nurse?
She is at home, recovering and doing very well.
She has passed the so-called 21 days yet? She has passed that?
She came out before her 21 days because she was tested a couple of times and they found her to not have the virus anymore after treatment. Yes.
Yes, and it seems as if there's something in some people that the virus don't attack them like other people. I don't know. Maybe there's a genes thing that is happening. What do you think about that?
A couple of my colleagues and I, we've discussed that, and we're waiting for the science to prove that otherwise, because that seemed to be the case. Yeah,
that there's some genes in some people. All right. So the family of this Mr. Duncan, where are they now? Because it passed 21 days, passed over a month now. Where are these people that he was living with when he just landed from Liberia? Where are they?
They're still here in Dallas. The last I heard, they were just still, struggling to find a place to live, and that's been a problem for them because of the whole stigma.
Everybody afraid?
Yeah, unfortunately, yes.
Well, I tell you that it don't reach here yet, and people scared. A Nigerian went to a hospital here for some other ailment, and people in chair who couldn't walk get up out of the chair and run out of the hospital. So you know, say this.
I saw the cartoon.
Oh yes, you saw that. Yes. Is that scary? So, tell me, what would you advise given that you were hands-on with this disease and as a Jamaican sister, what would you advise our government to do in order to prepare themselves and also in really taking care of an Ebola patient? What would you advise them on?
Well, again, just educate the medical team and the medical staff, educate healthcare workers, and give them adequate supplies that they will need. It's not going to be an easy thing. These patients, they do generate a lot of resources, and they're highly infectious, so you just have to educate healthcare workers and give them the resources that they need. Education is really important.
Okay. Maybe you should come. Yes. Maybe you should come here in Jamaica and give them some training. No, serious. Maybe you should come here and give them some training. Given that your training was hands-on, I listening to you.
Yes, it was.
Yeah, you never go to the university and get no trips and what. It was hands-on. So that hands-on sometimes is much better than sitting down in a class preparing for it, because then hands-on and you're still alive, so it was doing something right.
Yes. So Thank you.
So I don't know if maybe it's a possibility that you should come here. Maybe the government will want to pay your airfare to come here.
I wouldn't let them do that.
Why not? Tell me. Why?
I don't want to take advantage of my countrymen.
Okay. I can't see you reading the news there, you're reading the news there. But no, I mean, if the possibility arises that someone need your hands-on education about this thing, would you be willing to? How long have you not been? Have you been to Jamaica? How long have you been to Jamaica?
I haven't been home now in 2 years.
Then that's not long, man.
Yes, it is very long.
So you don't want a holiday, man? A working holiday? You want a working holiday?
Yeah.
I mean, if somebody decides, say, all right, we need the sisters, a Jamaican sister, to give us some hands-on argument, reasoning, about the treatment of this Ebola case before it reach here. You know, it's like preparation. I know you wouldn't say no, really. I mean, why would you want to say no?
I guess you're answering for me.
Of course, I'm answering for you because me the possibility can arise. All right, we want to give thanks. Give thanks for your time and your energy for really.
Thank you so much, sir.
Respond to this interview, and I hope I meet you again. Well, I say again because I feel like I'm meeting you now. And I know that you're going to, when you're going to Canadian airport now, they ask you, when last you been to Texas? That's weird.
It's funny that I got my letter from Department of Homeland Security yesterday telling me that I was cleared because I was put on a travel ban since the 18th of October, and they just took me off on the 3rd.
Just travel ban? I mean, to go anywhere? To
go anywhere. They had my name at all
the airports.
All airports.
You serious?
Yes, sir.
Like a terrorist?
It would seem like it.
Yeah, like a terrorist.
I guess you could look at Ebola as.
This sister who came back as one of the help in Liberia. She was put under almost like an house arrest, and she refused to stay in her house and tell the government or tell the new, I think it's New Jersey. And she said she's not staying in her room, so she take bicycle rides to show them, said nothing do happen to her. She's fit. You don't hear anything else about her? Have you last year about her?
It was last weekend. She, was apologizing and stating that she would comply with what was being asked of her because her neighbors were very upset and uncomfortable with the situation. Imagine.
But she's past 21 days now, though.
She should be.
Yes, up fast.
Yes, she should be.
Yes. Well, as I said, going through Canada, they ask you this question: when last you been to Texas? So I don't know if you people coming from Texas to Jamaica now, you will be asked that similar question. I doubt it though, but it's something to think about.
I would think so, but again, they said to me if I would want to travel, just make sure that I have that letter in hand.
So, to say that. Yes. Okay. All right, give thanks, Miss Rose. I really appreciate it. Give thanks to talk to you. You know what I mean?
Thank you, and you enjoy the rest of your day.
Yeah, man, give thanks. Yes, that was Sydia Rose, a Jamaican-born nurse who was among medical personnel who treated the first Ebola case in the U.S. You know, his name is Thomas Eric Duncan, and he died. And this was a lady who was looking about him in his room. This was a lady who was looking about him in his room. A Jamaican. We're in the thick of everything. No matter what it is, you have a Jamaican there. You understand? Me I tell you, no matter where they are. And me I bet, there's a brethren in a Liberia right now, Jamaican brethren, want to come Jamaica for Christmas holiday. And so he can't move. He can't move because there's no flight that him going to go on to go anywhere in the world. Yes, so if he just stay and just go eat up in room and think about the sunshine. Think about IRIEFM and all everywhere there. Just tune into IRIEFM and get like the Christmas breeze. And so, but now you go through Canada, them ask you, about Texas, Well, how long you been to Texas? Have you been to Texas? Dallas, to be specific. And them Canada, they ask you diplomatically too, Yeah. Anyway, we want to say Jamaica, we in everything. And this is one of the cases of Jamaica in the boiling part in everything. That this sister, is a Jamaican who was taking care at this first Ebola case. Now them say she pass her now. She free now. She in the quarantine. You hear that? Anyhow, she ever land at Jamaica airport. Immigration with a half duty immediately. They used to say come. Them say she? No sir. Immediately half duty. You know so much immigration send up outside and say, no sir, me not going there. And she did a look about the man and the man dead. Oh, me no say. I don't send them to that, I don't have to kill you half. You think Jamaica easy? And Jamaica not easy. All right.